So, Mr. Pat Patriot, my name is Dan Marsala, and I am going to be your respiratory therapist that's going to be working with you. So, pretty much what we're here to talk about is your test results came back, as you may know, indicative of interstitial pulmonary fibrosis, which your imaging, your lung biopsy, all that came back positive, your PFTs. So you might be wondering what IPF is, and in short, it's a progressive condition of the lungs where the tissue becomes scarred over time, which greatly affects your lungs' ability to function properly. Your scarring is going to start from the outside, and it works its way in, and this leads to difficulty breathing, as well as having difficulty for your blood to get the proper oxygen it needs from your lungs. It's been found that working around dust or fumes, having a history of smoking, being a male, and having a family history IPF all increase your risk of getting the condition. Your pulmonologist might prescribe you some medications, one being antifibrotic. These medications help manage your condition by slowing down the disease progression, and it helps prevent the scarring and the stiffening in your lungs. There's currently two types on the market, nintedanib and pirfenidone. Sorry, I know I butchered those names probably, but excuse me. Pulmonary fibrosis is different for every single patient. It's not a clear-cut condition like, bronchitis, where it's treated the same exact way for every patient. So we're going to try to tailor a treatment plan that's going to best meet your needs to help you out. So the first thing that we're going to do, we're going to have you complete what's called a 6-minute walk test. So we're going to measure your oxygen saturation with a pulse oximeter before the test, during the test, and after the test. So pretty much all we're going to have you do is just walk for 6 minutes straight, and while we're monitoring your oxygen saturation levels, this is going to help us determine if there is a need for you to have home oxygen. And don't worry, it's not something that's bad to have. If you do need home oxygen, there's many options available as far as oxygen goes. So some people need oxygen all through the day, some people just need it with exercise or activity, and then some people don't need it at all. So if you do need oxygen, there's, like I said, there's options available. There are small portable oxygen tanks that are easy to carry with you, or there are actually liquid oxygen tank units that you can have in your house, and then they have small portable home O2 units as well that just go right in a bag, hang over your shoulder. They're really lightweight, and if you do need exercising or being active, they're really easy to carry around with you. So it's been found that people that actually have IPF and use oxygen, that it actually has improved their endurance time and their oxygen saturation levels during exercise. So it's, like I said, it's actually very beneficial if you do need it, that you can get it, use it, and it actually helps with activity and stuff like that. So next, we want to set you up for a consult for pulmonary rehabilitation. And don't think of it as like, rehab as, for a knee replacement, that kind of thing. Pulmonary rehab is going to help you with things as far as exercising, doing breathing exercises, nutrition management, mental health management for, things like depression, because I know IPF is unfortunately a debilitating condition, and people get down about it. So, with rehab, it's going to help with counseling, that kind of stuff as well. So some of the potential benefits of pulmonary rehab are improved breathlessness at rest and with activity, increased exercise capacity, improves quality of life, and reduced anxiety levels. So it's super, super, super important to get into a pulmonary rehab program. Like I said, doing that cardiovascular exercise, it's going to help just improve that overall quality of life. And then lastly, we would like to schedule you for a palliative care consult. Now, don't confuse palliative care with hospice care. We're not talking about, strictly end of life planning, that kind of thing. Palliative care is to help support you during your condition. It's going to help with management of your symptoms, and as your condition progresses, it's going to allow you and your family to decide a plan of care that is going to best meet your needs as things progress. Also, while being enrolled in palliative care, it allows you the option of being enrolled in a clinical trial for new medications that come out that treat IPF. So that's always a great option if you want to take that route. A new drug comes out, you can get involved in a trial for it. Also, while being in palliative care, you can opt to be considered for a lung transplant if that's also a route that you want to pursue. Studies have shown that early enrollment in palliative care programs actually have lowered depression scores. Also, they increase quality of life, they provide better end of life planning, and they lead to longer overall survival in patients. So it also has shown that it's lowered respiratory related emergency room visits and hospitalizations, which obviously these are important things because you don't want to be stuck going in and out of the hospital all the time over the next couple of years here. So by all means, we're here to help you. And these are all great options that we want to get you started with right away, because all these things, HOMO2, pulmonary rehab, and palliative care are all things that are going to really, really, really just improve your overall quality of life and make working through your disease progression easier for both you and your family at home. So if you have any questions, feel free to ask, and we're always, like I said, here to help you out.